The subjective effects of morphine include the following except visual hallucinations, dysphoria in many uninitiated individuals, euphoria in dependent subjects, detachment to self and surroundings. Actions of morphine include the following except antiemetic. Morphine shows vagal stimulation, meiosis, postural hypotension. Morphine induced fall in blood pressure involves the following factors except direct cardiac depression, it involves direct reduction of vascular tone, vasomotor center depression, and histamine release. The following drug can be used as an alternative to lithium in mania and bipolar illness, that is carbamazepine. The constellation of side effects consisting of thirst, polyuria, looseness of stools, and fine tremors is characteristically associated with the following psychotropic drug, that is lithium carbonate. For therapeutic effect in maniac depressive illness, steady state serum lithium concentration should be maintained between 0.5 to 0.8 milliequivalent per liter. Select the psychotropic drug having a narrow safety of margin, that is lithium carbonate. Renal excretion of lithium is reduced by furosemide, hydrochlorothiazide, and indomethacin. Indications of tricyclic antidepressant include the following except mania. Tricyclic antidepressants are used in prophylaxis of migraine, panic disorders, attention deficit hyperactive disorder in children. The following statement about lithium is not correct. Incorrect statement is it has a sedation action in normal individuals, and the correct statements are it controls mania but takes 1 to 2 weeks to produce the effect. It has prophylactic effect in recurrent unipolar depression. It can be combined with tricyclic antidepressant for refractory cases of major depression. The tricyclic antidepressants are also effective in the following psychiatric disorders except in schizophrenia. Tricyclic antidepressants are effective in obsessive compulsive disorder, bulimia, phobic states. A 30-year-old woman suffering from endogenous depression improved after 1 month of treatment with amitriptyline. How long the drug should be continued? 6 to 12 months. Diabetic and other types of neuropathic pain often responds to imipramine. A patient of endogenous depression was put on imipramine therapy. After what interval the therapeutic effect is likely to manifest? 3 weeks. Prolonged painful erection of penis has been noted particularly as a side effect of trazodone. Which of the following is labeled as serotonin and noradrenaline reuptake inhibitor or SNRI? That is venlafaxine. Choose the drug that has been labeled as a noradrenergic and specific serotonergic antidepressant, that is mirtazapine. The following is true of bupropion except it produces sedation as a side effect. The true statement about bupropion are it inhibits dopamine reuptake along with inhibiting noradrenaline reuptake. It is being used as an aid for smoking cessation. It is likely to produce seizures in overdose. The following antidepressant increases rather than inhibits 5-HT reuptake into neurons, that is tianeptine. Venlafaxine differs from standard tricyclic antidepressant in that it does not have anticholinergic or antiadrenergic property. Currently, the selective serotonin reuptake inhibitors are the preferred drugs for the following psychiatric disorders. That it is effective in phobia, obsessive compulsive disorder, post-traumatic stress disorder. The distinctive feature of fluoxetine compared to the typical tricyclic antidepressants include the following except it does not block neuronal uptake of biogenic amines. It is likely to produce cardiac arrhythmias in overdose. It infrequently produces sedative and anticholinergic side effects. It can elevate mood of apparently non-depressed patients suffering from chronic somatic illness. Advantages of selective serotonin reuptake inhibitors include the following except no interference with ejaculation and orgasm. It has minimal sedative action, unlikely to cause fall in blood pressure, lack of seizure precipitating potential. Choose the selective serotonin reuptake inhibitor that is less likely to inhibit CYP2T6 and CYP3A4, resulting in fewer drug interactions. That is sertraline. The following is a tetracyclic antidepressant that has additional dopamine blocking and neuroleptic properties, as well as greater propensity to cause seizure in overdose. That is amoxapine. The selective serotonin reuptake inhibitors have overcome the following limitation of typical tricyclic antidepressant, that it is frequent anticholinergic, sedative and hypnotic side effects, high risk of cardiac arrhythmias and seizures in overdose. Limitation of typical tricyclic antidepressant include the following except low oral bioavailability, narrow safety of margin, frequent side effects, long latent period for response. Tricyclic antidepressant abolish the antihypertensive action of following drug: clonidine. A 65-year-old man was brought to the hospital with complaints of pain in lower abdomen and not having passed urine for 16 hours. The bladder was found to be full. His son informed that he was depressed for the last 2 years, and only the day before a doctor had given some medication. Which of the following drug is he most likely to have received? That is amitriptyline. The following drug should not be used to treat tricyclic antidepressant drug poisoning. That is digoxin, atropine, quinidine. Adaptive changes in brain monoamine turnover due to blockade of noradrenaline or 5-HT reuptake is credited with the following effect: antidepressant. The mechanisms involved in the causation of dangerous cardiac arrhythmias due to overdose of tricyclic antidepressant include the following except increased vagal tone. It has intraventricular conduction block, potentiation of noradrenaline and antagonism of acetylcholine. Of the following, choose the antidepressant having both sedative and high anticholinergic activity. That is amitriptyline. The antidepressant which selectively blocks 5-HT uptake is fluoxetine. Imipramine produces the following actions except euphoria. It produces dryness of mouth, tachycardia, lowering of seizure threshold. Choose the correct statement about moclobemide. It is a reversible inhibitor of MAO-A with short duration of action. Imipramine given to non-depressed individual produces lethargy and lightheadedness. Which of the following MAO inhibitor is most likely to produce cheese reaction? That is tranylcypromine. The following is a reversible and selective MAO-A inhibitor. That is moclobemide. Cheese reaction in a MAO inhibited patient manifest as hypertensive crisis. The following drug of abuse is a hallucinogen, that is cannabis. Which of the following is a selective MAO-B inhibitor? That is selegiline. The non-selective MAO inhibitors are not used clinically as antidepressant because of their higher toxicity and potential to interact with many foods and drugs. The preferred class of drugs for long-term treatment of severe anxiety disorder with intermittent panic attack is selective serotonin reuptake inhibitor. Choose the correct statement about the use of propranolol in anxiety. It suppresses the autonomic manifestations of acutely stressful situations. Select the drug which relieves anxiety but neither reacts with benzodiazepine receptor nor produces any overt CNS effect. Buspirone. The major constraint in the long-term use of benzodiazepine for treatment of generalized anxiety disorder is possibility of drug dependence. Which of the following is a non-selective anxiolytic? That is buspirone. The following statement is correct about buspirone. It has anxiolytic but no anticonvulsant or muscle relaxant property. The following statement is correct in relation to diazepam and chlorpromazine, that both have anti-anxiety action. Select the anxiolytic benzodiazepine that has additional mild antidepressant property, that is alprazolam. The following is correct about antipsychotic drug except combination of two or more antipsychotic drugs is efficacious than any single drug. The correct statements are: the only control symptoms of schizophrenia without affecting the basic disorder. In treating psychosis, high potency drugs are preferred over low potency drugs. They do not produce dependence. Select the drug which should not be used to treat neurotic anxiety and tension syndromes despite having anti-anxiety action. That is chlorpromazine. Chlorpromazine is ineffective in vomiting due to motion sickness. The psychotic syndrome symptoms most benefited by neuroleptic drugs are hallucinations, delusions, and aggressive behavior. A manic patient has been brought to the hospital with non-stop talking, singing, uncontrollable behavior, and apparent loss of contact with reality. Which of the following is the most appropriate drug for the rapid control of his symptoms? That is haloperidol. The following adverse effects can occur even long after withdrawal of the offending drug. That is tardive dyskinesia. The extrapyramidal adverse effects of antipsychotic drug therapy which does not respond to central anticholinergics is tardive dyskinesia. The antipsychotic drug most likely to cause ocular toxicity on long-term use is thioridazine.